just means those that weren't able to make it can catch up on that, and it gives us a wider reach. So today's session is on social prescribing. My name's Lee Meller. I'm in the NHS Derby and Derbyshire Communications Engagement team. And social prescribing's an approach bringing together people with activities, groups and services in their communities being delivered across Derbyshire. We've got with us Claire Burgess, Commissioning Manager, and Faye Benskin, Personalised Care Role Ambassador, to do the presentation on social prescribing, and I'll let each of those introduce themselves as a hand across for their presentation. They'll be doing a presentation and there'll be an opportunity for a Q&A for people to ask questions and give feedback. So feedback from today's session will be fed into the system and you can be kept up to date with information by accessing what we call the Derbyshire Involve engagement platform. I'm sure Mark can pop a link into the chat where you'll be able to find the recording from today's session and those of past sessions in the Derbyshire Dialogue Initiative. So just a quick run through of some of the Microsoft Teams functions. We're running this off Microsoft Teams today. We've got the control bar, depending on the device you're using, if it's a laptop, a mobile, things might be slightly different. But just running through, you'll see the people icon as I'm hovering my mouse over. That should be somewhere on the top or down the side of your screen. You can see who else is on the call. You can click the chat box, the comment type function then. Again, it's a little bit device dependent, but it looks something like that to open up the chat. So feel free to put any comments or observations in the chat, though hopefully we'll answer a lot of the things as we go through the presentation. When we get to the question and answer section, there's the functionality for people to be able to raise their hand to ask a question. So please do use that, and we'll, between picking comments out of the chat box and the hand raise function, we'll look to answer as many questions as possible. If we don't get through them all, apologies, but we'll pick them up, we'll collate them and get back to people. We'll disseminate the answers after the session. So part of today's session is going to be interactive, where we'll be asking you a few questions, and you'll be able to answer these questions in a few different ways. We're trying to make this as interactive and engaging as possible, and you'll notice that some of the slides that we go into, there'll be a QR code that you can scan with your smartphone camera, where you can type in your response. You don't have to do that. We just like to do that because it's a system where answers come up on screen and we can see it live in real time. You can also use the functions previously mentioned, raising your hand or the chat box, put a comment in there and marks on hand to copy and paste that in, and we'll see those come up live on screen. So the addition of Slido, the slides where you see the QR code, it is in addition. We've got the usual functions that we have of raising a hand, putting a comment in the chat box, that we'll get to in the Q&A. So if people could please turn off their cameras if you're not a presenter or the BSL interpreter, that just helps keep focus on the bits that we're showing. I'll turn myself off shortly. I've mentioned the session is going to be recorded, and just like we're turning the camera off, if people could keep the microphones muted, that would also be absolutely excellent as well, just in case we get any background noise. I think I've probably covered these by now. As I say, we've got the chat box function. Any questions that we don't get round to, we'll cover after the session. So please remember to listen with an open mind, respect each other's views, try to keep in line with the agenda, and if the point has already been raised, please try not to repeat it. So I'm now going to stop sharing my screen and I'm going to hand over to Claire and Faye.
Bear with me, I forgot to select the sound included button. Sorry. Can you see my screen?
Yes.
Brilliant. Okay, well, thank you everybody for coming today. We're really excited to tell you about social prescribing. Social prescribing is doing a lot of brilliant things across Derbyshire. So today will be a really good chance for us to tell you a little bit more about that. So Lee introduced me really well already. My name is Claire Burgess. I'm a commissioning manager. My job title from April will be partnerships manager, which feels a little bit more fitting for what I do. So my work areas are social prescribing, the voluntary sector. I lead on a digital social prescribing platform called Joy, which we'll touch on a little bit in this presentation. And I'm also currently working on community audiology. So as you can imagine, that keeps me quite busy. And then I will be presenting the more strategic side of things. But then we've also got Faye. Do you want to introduce yourself, Faye?
Hello, everybody. My name is Faye Benskin. I'm a personalised care roles ambassador for the Hub Plus Derbyshire, which is a training provider. I work with social prescribers that are delivering the service across Derby and Derbyshire and support them with their work, and also advocate for any training needs that they have, and also work alongside Claire in any partnerships work that we can support with.
Thank you, Faye. So the aim of today's presentation is to tell you more about social prescribing, what it is, where it came from, and how it operates in Derbyshire. So that will include a description of social prescribing. We've actually got a video for you today. We've got a couple of videos, and one of them will tell you a little bit more about social prescribing. We'll tell you about the Derbyshire setup and the referral process. I've got referral information for each of the social prescribing teams, which if that hasn't already been shared with you by the engagement team, they will be able to do so after today's presentation. We'll talk to you, this is where Faye comes in. She'll talk to you a bit more about the operational context and she'll share a case study. We'll then share a very broad overview of our aspirations or calls to action. And then it's your turn. We'll be here to answer any questions that you may have. Now, Lee has told you already that we'll be using Slido. So I just wanted to emphasize that there's about 5 questions throughout here, which we'll use Slido. In fact, the next slide. So while you can use the chat if you don't have a smartphone, please do use Slido if you can. You can use it on your computer as well. Once you've got on the first question, it should just flow. So maybe we'll just take our time with the first question to make sure we've got everybody online. So here is the first question. It's a yes or no answer. Have you heard of social prescribing? So you can use your smartphone to scan the QR code, or you can go online, you can type www.slido.com and type in that code there, 1926535. So I can see some people have started to vote already. I'm quite happy to see that most people so far have heard of social prescribing. I'm just going to test it myself. I was the no, by the way, just to make it a bit more varied. I'll cancel that though, because it's not true. Okay. So a very, very large majority of you have heard of social prescribing. We'll just leave it a little bit longer to get some more responses.
Yeah, we can see in the top right of the screen as we look at it that we've had 17 participants answer so far, just ticked up to 18 there as we can see it. So that's great, thanks.
So we've got about half of you have answered this question. Okay, it's probably safe to assume that those who are going to answer have answered by now. So I'll now move on to the next question. Your device should just follow with the presentation. So the next question is, what is social prescribing? So now you've got a free text box. So we want you to tell us what you think social prescribing is. We don't mind if you can use a sentence, you can use words. Just give us an idea about what is social prescribing. What do you associate it with? What is it? Oh, I like that one. Social prescribing is a person-centered, holistic approach to connect people with their community. Yeah. Okay, so we've got that non-medical side, the signposting, the linking. Oh, yeah, I like the people who are recognising the voluntary sector. Supporting primary care. Holistic, yeah. Yeah, I think you've got a good idea about what social prescribing is. There's not a limit, by the way. If you want to put more than one thing in, please feel free to do so. So I can see now that Slido is grouping some of the themes. So about people, community service, support, activity, health groups. I think that's a good summary. Yeah, I can see that some people are still typing, so I'll just hold on for a little bit longer.
They might know more than us, Claire.
Yeah, they might do. Yeah, there's quite a lot of people talking about primary care, which is interesting. We'll touch on that a little bit later on. Socially orientated, walking and talking is great. Okay, I can see that 22 people have participated and I can't see that anyone else is typing. So thank you everybody for your contributions. We'll now move on to, so now we've got a video. This is going to tell you what social prescribing is. It's about 2 minutes long. Can you hear it okay? Brilliant.
Many things affect your health and well-being. GPs tell us that a lot of people visit them feeling isolated, lonely, or stressed out by work, money, and housing problems. These are issues that can't be fixed by doctors and medicine alone. At its most basic, a social prescription offers a kind of help that doesn't come in a tube or a bottle. The idea behind social prescribing is to help you to have more control over your healthcare and find ways to manage your needs in a way that suits you. There are lots of different ways of providing social prescribing services. It often starts with a conversation, perhaps with a link worker, a support broker, or a community navigator. Whatever they are called, they are there to listen to you and put you in touch with whatever it is you might need in order to feel better. That might mean being introduced to a community group, a new activity, or a local club. It could be legal advice, volunteers to help around the house. It might just be information and guidance, a bit of inside knowledge on your situation and what local resources there are available. It could even be some support in how to create something new. Studies show that individuals with social prescriptions get better and feel better faster than those treated with medicine alone. And because it works, it's happening more and more. To find out how it can work for you, talk to your doctor, health professional, or local authority today.
So I think that gives you a really good summary of what social prescribing is. One thing I want to point out from that video is that there's not one job title for a social prescriber. So we will talk a little bit more now about social prescribing link workers, but not every PCN calls them social prescribing link workers. So in Erewash, for example, they will call them the GP link workers. So there isn't like a universal job title of a social prescriber. There are many different job titles that might be used, but commonly within PCNs, we do use the title social prescribing link worker. Okay, so we've got a question for you here. True or false question. So please get your Slido ready. Social prescribing was introduced in 2019. True or false? What do you think? We've got 50-50. Okay. A lot of you think it was true. Some of you think it's false. I love the way we get that live dynamic view of what everybody thinks. Okay, so 19 people have voted. I think we had 22 people last time. Wait a little bit longer. Okay, so this was a little bit of a trick question. So I'm not surprised that you were a little bit divided on this one. So I can see here that more of you think it's true, but we do have quite a lot of you that think it's false. So no, so more of you think it's false. Sorry, got that the wrong way around. So yes, more of you think it's false, but a big group of you think it's true. So the question is both true and false. So you were never going to get it completely right. So it is true that social prescribing was introduced to primary care as a new concept in 2019. And we'll go into that in a little bit more detail in this presentation. But it's actually existed for a very long time as a part of many different people's roles. So, you know, whatever your role was, you could be a nurse, but you might be linking people. So social prescribing is an aspect of many people's roles that have existed for a very, very long time. It's always existed really when kind of support workers have been linking people with groups and activities. So well done on everybody participating, because there wasn't a right or wrong answer there. I just put it in there to get you thinking. So a little bit of the technical history now. So in 2019, the long-term plan was introduced, and this set out the NHS ambitions over the next 10 years. So as part of the plan, groups of GPs joined together to form primary care networks to deliver many of these commitments. We've got a map a bit later on, which will show you the PCNs across Derbyshire. There are around 18. This does change, but there are around 18 PCNs in Derbyshire, and they are groups of GPs working together. So social prescribing was added to GP practices and doctor surgeries as part of the NHS long-term plan. And social prescribing is part of the wider approach to personalised care. So if you look at the image on the right-hand side, this is kind of like the logo for personalisation. So it's about asking what matters to me, listening to what matters to the patient, and that is the motto at the heart of personalisation. And that is why social prescribing forms part of that agenda, because it's a central part of that worker's role is to listen to the patient and find out what is going on in that patient's life. A lot of link workers have told me that the presenting issue is not necessarily the issue that they will uncover when they work with that person in depth. So it's about moving away from medical solutions and looking at the patient as a whole, the wider things that are going on in their life. Now, I think you know that because you gave us some really good descriptions that kind of cover that aspect already. Faye, you were going to do this one, weren't you?
Thank you.
So this is like the NHS view of the 3 personalisation roles, which Faye is going to tell you a little bit more about.
Yes, that's right. So when the NHS were looking at the personalised care roles, they identified 3 separate roles that would fall into this bracket of support for what matters to patients. So as you can see here, we've got care coordinators, health and wellbeing coaches, and social prescribing link workers. Now, it's worth being aware that across Derby and Derbyshire, not every area has got all of these. They predominantly will have social prescribing link workers and care coordinators, but they may not all have health and wellbeing coaches. So it's always worth asking at your GP practice, if you're wanting to access this support, what they have and what's available for you to utilise. So a care coordinator will work with people that are mainly over 65. They will be very much able to support the frail or elderly people. They will coordinate care plans for those individuals. They work a lot over the telephones. They don't necessarily see people face to face. And they definitely provide a lot of information and work closely with adult social care and the secondary care services like the hospitals and the community services as well. Then we've got health and wellbeing coaches who work with people to build their motivation to make changes within their lives or their lifestyle. So they might work with people that have low motivation, long-term conditions, physical or mental health needs, or low confidence. They often work one-to-one with patients, and they might work face-to-face as well. So they'll have a period time to work with a patient, and help to build their confidence, their knowledge and their skills to then be able to manage their health better. And then they might move a patient into working with a social prescribing link worker. So that link worker will work with people with mental health needs, people that are very lonely, isolated, individuals with long-term conditions or complex social needs. Big part of what we have to remember with social prescribing link workers is we're looking at the social side of things and the linking, and the huge part of our work is the linking to other services in the community or in the statutory sector. So that might be adult care, it could be hospitals, additional services within primary care, but they're linking patients to support. Back to you, Claire.
Okay, thank you, Faye. Okay, so Faye has given you a really good overview of those 3 roles, which we consider to be the personalised care roles or the non-clinical roles. So there are around 18 or more roles within that were added to GP surgeries. And so these are the 3 which don't require medical training. So this slide gives you a breakdown of how many of those roles we have in Derbyshire. This data is only as accurate as the data we're provided with, so sometimes there's a little bit of a lag. But as of January, we had 82.88 full-time social prescribers across all of the PCNs. We had 157.16 full-time care coordinators. And when I say full-time equivalent, what I mean is like there might be part-time workers, but say you've got 2 half-time part-time workers, they would count as 1. So that is a mixture of full and part-time staff. And then we've got 16.98 full-time equivalent health and wellbeing coaches. So as you can see there, we've got more care coordinators and social prescribers and not quite so many health and wellbeing coaches. The roles were introduced to GPs in a phased approach. So sometimes the health and wellbeing coach, for example, was introduced a little bit later than social prescribing. So it may be that role is still taking off. So I recognise that this slide has got a lot of information in there. I'm going to talk you through it, but I think you might want to have a proper look at it in your own time because there's probably too much information to take in. So this is a map of Derbyshire. So you can see in the middle, the Derbyshire is broken into different colours. So each colour is a different PCN. So that's a primary care network. And as I described earlier, these are groups of GPs who are working together. And that's new. They weren't doing that before. So you can see each PCN has got an arrow or a little matching coloured square next to it. And that tells you how many social prescribers there are within each of those PCNs. So you can see that every PCN has at least 1 social prescribing link worker. Like Glossop, for example, has got 1, North Derbyshire has got 1, but then you've got larger social prescribing teams, such as where Faye comes from. So Chesterfield and Dronfield have 7, Greater Derby have 9.4, High Peak and Buxton have 9.52. So, you know, you've got a very big variety in how PCNs have chosen to deliver social prescribing. So the PCNs can choose how many staff they employ, and there's like a number of different roles they can choose from. So some areas have chosen to have lots of social prescribers, whereas others perhaps have chosen to have less. And each team has a slightly different interpretation of social prescribing as well. Like, so it's not universally the same across Derbyshire. It really depends on your PCN. I think I mentioned earlier that I have got a list of social prescribing contact details for each of the PCNs. So if you wanted to access a social prescribing service, the best thing to do is contact your GP surgery. But if you wanted to contact a social prescriber, you could use this list to find contact details for your PCN. You need to find out which PCN your practice is in, and then you'd be able to find the PCN, you'd be able to find those link workers who work in that PCN. Now, the 2 orange boxes, they are slightly different in that they are not funded by the PCN funding. The Thrive Children's Social Prescribing project is now funded by 4 northern PCNs, but it was actually initiated by DCHS. So that is a children's social prescribing project based out of Chesterfield Football Club, and they provide services for PCNs. Some social prescribing teams are embracing children's social prescribing link workers. It's something that is developing and growing. Now, the other one, the orange box on the left-hand side, this is the Glossop Community Wellbeing and Asset-Based Solutions. So this came across from Tameside, and it's a Glossop specific service that is funded by the ICB because it's a different way of doing things. And this one has a small grants pot attached to it, and that helps the social prescribing team and the community development workers allocate resources to those services that are helping social prescribing. And we'll touch on that a little bit later about how social prescribing is great, but you've got to think about the voluntary sector too, because that is where social prescribers refer patients to. And if you don't have someone to refer patients to, then social prescribers might hold on to the patient for longer than they need to. So social prescribing link workers are either employed directly by their PCN. So you can see in the yellow boxes, all of those listed in the yellow box on the left-hand side. Those link workers and those PCNs are employed directly by their PCN, or the yellow box on the right-hand side, link workers are based within a voluntary sector organisation. So you can see those PCNs there. So those social prescribers work from our volunteer centres, our community action centres, our CVSs. So the experience of social prescribers is quite different depending on where they're based. But then sometimes we also have a mixture. So for example, in Erewash and Glossop, we've got a bit of both. We've got social prescribers linked in the working in the voluntary sector and also from GP practices. And just because they're based in the voluntary sector, it doesn't mean they don't work in a GP practice. It just means that their base is a voluntary sector organisation, which gives them really good access to information about what's going on in communities. And each model of social prescribing is different, and there's not one better than the other. They're all working in their own unique ways based on the needs of their community. So we've got another video for you now. So last week, March the 14th, was Social Prescribing Day. So some social prescribers in Derby City organised an event at Derby on Shopping Centre. So this video is also about 2 minutes long, and you're going to see some real life social prescribers talking about their experience of social prescribing and you know, what was going on the day.
Today it's National Social Prescribing Day. A social prescriber is someone who works with GP surgeries and they support patients with anything that's non-medical, housing, finances, loneliness, isolation. Social prescribers are more of a signposting service, so what we do is aim to connect patients with services that will be able to help them better. So like Live Well can help with weight management, smoking cessation, things like that, leading a healthy lifestyle. We've got the employability programme that can help people that are struggling to find employment, to help them get employment and stay in employment.
So we offer weight management support, we offer stop smoking support, we also deliver NHS health checks, we do receive referrals from social prescribers. At the same time, when we talk to people about their health goals, they will quite often mention other issues or other challenges they have within their lives.
Our main objective is health and well-being and their mental well-being. So they come into us, they give us their long-term conditions or their needs and their goals, and we work with them out in the community with their social prescribers. We've got an array of classes from physical activity to social, so coffee mornings, to the gym, to yoga, to Pilates, to swimming, to walking football, and then most importantly, a walk, cup of tea on the park, and then one of our allotment sessions as well.
We work with people that have got issues with mental health, disabilities, and helping them with support to stay in employment and getting them into work. We might help people with their travel, getting on that bus, getting it actually into the office, getting suited and booted for the job, and getting their motivation up to stay in employment. The benefits to the people that we work with would be motivation, engagement, independence, and being financially stable.
It's linking them in to other community services that are out there to improve the well-being of the whole community.
Okay, so what you heard there was some social prescribers, but there were also a lot of the type of services that social prescribers would refer patients to. And all of the agencies work together to provide the support that the patient needs. That the social prescriber, part of their role is to link in there, build those relationships with those referral agencies, which is a really, really important part of social prescribing service.
Today it's like
Okay, so this slide here, I'm going to share with you some of the highlights from the Joy social prescribing platform. Now, this was a pilot project, and unfortunately, it isn't going to carry on, but it just shows you some of the impact data that we collected during that time. So Joy is a digital platform that was used in 10 of our GP surgeries, and it just enabled us to show a little bit, of the impact. So over the course of a year, from the 19th of December 22 to the 19th of December 23, we were able to evidence that for every patient accessing social prescribing, there was a reduction of 9 GP appointments per service user. So if you think about that, this is a patient who perhaps was regularly going to see the doctor. Once they were seeing a social prescriber, their number of GP appointments they were accessing was reduced by 9. So it just goes to show how much impact social prescribers are having on primary care, and how they're taking patient pressure off GPs and giving them support with somebody who's got time for them, which GPs just don't really have. But during that time, you can see that over 11,000 referrals were supported, and that's not all of the social prescribing referrals that were received. It's just those that were recorded by this platform, which is just over half of our PCNs. And during that time, 661 voluntary sector services were accessed, and a 76% client wellbeing improvement was recorded. So it just goes to show that social prescribing is having a really, really big impact on the lives of patients. So as part of my role, I chair, or sometimes with Louise Swain as well, the Social Prescribing Advisory Group. So this was set up in Derby and Derbyshire in May 2019. So we have people come to speak about related services and how we link with other services. SPAG supports the delivery of social prescribing across Derby and Derbyshire, and we try to tackle some of the problems and find solutions. So it's a multi-agency group coming together to work together to try and make social prescribing better in Derbyshire. So over the summer, we used the social prescribing maturity framework. So this was an assessment. So it asked participants a range of statements about what a mature social prescribing service would look like. And we had a range of people complete this assessment. We had link workers, we had managers such as Faye, we had place managers, commissioners, we had operational staff or leadership staff within practices. So we had quite a large number of people complete the survey, sometimes individually, sometimes as a team. And so we have now summarised those results. There's a lot of much more detailed results than what I'm going to share with you today. But from those results, we were able to identify 5 key things that we want to focus on. So the first point is data to show impact. So we want to get to the point where I showed you that data from Joy. We want to be able to show things like that for the whole of Derbyshire. On the ground, PCNs are doing a lot of really good work. We want to find a way to collate that centrally so we can measure the impact of social prescribing and use that in an intelligent way to allocate resources, to identify where the greatest need is. So another thing that was identified was that we need better funding for social prescribing. So there is funding for social prescribers, but there isn't funding for the social prescriptions. So this creates a challenge for social prescribers because there isn't enough activities for them to refer patients to. Another point was identified around strong leadership. So that was both from an ICB perspective and a leadership perspective. And it's not easy because each PCN works in their own unique way and has their own unique needs. But there was something about being standardised and trying to work together as a Derbyshire footprint to think about what we want for social prescribing collectively. So that is something we are kind of looking at now. So the next point was around underrepresented groups, and this links back to the data. So if we have more data, then we know where those underrepresented groups are. So we know we can focus on them more. So we think that social prescribing could be doing more around accessing groups with the greatest needs if we had that information. So, and where we do have that information, we want to be able to target more our time and energy. And then the final point was about having a clear referral criteria. So social prescribers receive a lot of referrals. There is a waiting list, and sometimes referrers send patients to social prescribers because they don't know where else to send the patient. So we wanted to be clearer about those boundaries, about what sort of referrals should be coming to social prescribers and what sort of referrals should be going elsewhere. And now it's your turn, Faye.
Lovely, thank you. So I'm just going to speak through a case study of somebody that's been worked with quite recently in the service that I work in Chesterfield and Dronfield. This was provided by a social prescriber in the team. So she was working with a young man called Joe, who was 25 years old. He'd spoken to his doctor about really experiencing low mood. He'd moved out from his family home after disagreements and was living in supported accommodation, lacking things to keep him busy and feeling really quite isolated, wanting to maintain his sobriety. He had previously been drinking very heavily and wanted to move away from that. So he came to the social prescriber at a point where he was settling into his supported accommodation, but really trying to work out where to go next. So from working with the social prescriber, he met with her face to face, spent an hour with that worker on that first appointment, really working on what matters to Joe, what's important right here and now, what does he want to work on. From that conversation, they were able to establish a few different pointers that were most important to Joe and what he wanted to link in with. So at first they explored some immediate support, which was in the form of a food bank. He'd discussed having some financial difficulties and struggling to manage on the limited income from Universal Credit. So he was linked with a local food bank, but also they linked him to a community pantry where he was able to access cheaper, lower price goods, but still be able to pay for them. So then we did an assessment with him around his benefits to make sure everything he was entitled to was appropriate. The Citizens Advice Bureau are based inside a lot of our practices, so they were able to link him directly in for a CAB appointment just to review his benefits and make sure that he was getting everything that was right for him. That proved to be really useful because there was a realization there was benefits that he wasn't actually getting, so allowed him to increase his income at that time. Then they started to look at linking with groups and activities. That came in the form of a men's mental health football session that ran on a weekly basis. Great opportunity to connect with others that might be struggling or trying to maintain their health and well-being as well as their mental health. So he started to attend some exercise sessions there. He also supported a referral to go to Live Life Better for a stop smoking support. Through that, he was able to access some patches and the relevant advice and guidance to give him the opportunity to stop smoking. And then they started to talk in more detail over the appointments around his mental health. And that allowed a referral to the IAPT service, which is improving access to psychological therapies. It was a referral to specialist counselling where he joined the waiting list, went through the first sort of assessment process and then waited for his appointments. He then engaged very well with some specialist CBT counselling support, and that allowed him the really more specific mental health focus for him. And at the same time, the social prescriber went out with him into the community and went to the local warm spaces, the hubs that we have, which are sort of wellbeing hubs that are available. And we also have a wellbeing cafe in Chesterfield that they visited together, all of which allowed the patient to see what was available in the community and make his decisions about whether he wanted to engage or not and which things suited him best. And as a result, this young man is now regularly attending the football sessions and really loves the connections with others, to the point where they've become friends, and then they spend time with each other outside of that. He stopped smoking, which is absolutely fantastic. I think it was a tricky journey in his stop smoking, so it's not simple, but he has maintained his stop smoking status, and having access to that specialist counselling through IAPT. He's really improved his mental health, and as a result is reporting to feel an awful lot better. He's now finished with the social prescriber, and like I said, doing really well. And just a quote from the patient there is, "I didn't realise how much my social prescriber could do to help me. I'm so happy with the referrals and introductions. I feel fully supported throughout." So that's a nice example of some of the work that we can do. And then here we've got a bit of just an example of what a social prescriber might get up to throughout their working day. It's a very varied role, and I think this really does demonstrate what they might get up to. So they might get into work, possibly in practice or in the volunteer centre, check their emails, check their diary and prep for the day. Then they might go out for a face-to-face meeting, go out to a group, introduce a patient there. They might meet them in their home and walk and talk with them. There is some travel and some movement around the community, but again, we still see patients in the practice or at the volunteer centres. So you'll find a social prescriber, as you can see here, at the cancer support groups or chair-based exercise, or even down at the local football club, where we are all over. We try to liaise an awful lot with our GPs that we work alongside in the practice. So as you can see here, the social prescriber will go for a meeting with the GP partners and discuss any patients they're working with, if they've got any concerns, but also to promote the role and the service that they're offering. And again, they'll be back out and about in the community, going to a group with a patient in the afternoon, and then maybe back to surgery to make some phone calls, welcome some new referrals into the service by phoning them, discussing their needs and making sure they're right for the support that we offer. And then what have we got there? Returning back to surgery, writing up notes, quite a lot of admin, as you can imagine, that comes with the role, and then planning again for the next day ahead. So it's a very busy, varied role. I am told it's a very enjoyable job, but as you can imagine, you need to be an expert in a lot of things to do well at it. Thanks, Claire. Oh, this is my slide as well. So just some key points as sort of takeaway ideas to be mindful of with social prescribing. One of the main things is that it is a short-term intervention. So it's a short-term service. Social prescribers don't work with people for a very, very long time. We look at a number of appointments where we're linking patients to the support and then moving them on in that journey to make sure that they've got the support in the community or from those specialist services. And what we do with those interventions, that short-term support, is we work on what matters to me, what matters to the patient, and we look at all parts of the patient's life. We try to build a strong relationship with the patients so that they trust the work that we're doing with them, and then it helps with us going out in the community with them and introducing them to those other services. We always look to establish some realistic goals, and we have an action plan with our patients. So we'll always try to write down what we're going to do so that everybody knows who's doing what, where and when. And the main aim is to connect people to the wider community support and activities that are available. And at the same time, we're addressing the underlying causes of ill health. So we're moving away from what's called a medical model, not looking at medicine being the answer, but looking at the wider things in people's lives that have a huge impact on how they feel. And our aim is to motivate people to make changes for themselves, to their lifestyle, and to improve their health and well-being. Thanks, Claire.
Okay, so we've got a couple of Slidos at the end, but I'm conscious that we are running out of time. So I think we maybe focus on the questions, and if we've got time at the end, do the Slidos. So, are there any questions?
So feel free to use the hand raise function here. I'm just trying to pick anything up out of the chat box that may not already be answered, but I think most of them were covered.
Yeah, all the chat's covered so far, Lee.
Okay. Well, if there are no questions, then we could do the other Slidos.
Go for it.
Okay.
The sign of a good presentation when there's not too many questions afterwards.
I'm frightened there's no questions.
Yeah, I'm glad we got to ask this question actually, because I'm interested to know the answers from people. So it's
Yeah.
another free text question. So we want to know, what do you think could improve social prescribing? And again, you don't have to put in one thing, you can put in multiple things, you could put in sentences or you could put in words. So yeah, and we know about funding. I'm sure you'll all say that, but please do tell us what you think could improve social prescribing.
Yeah, we'd love to hear.
I knew funding would come up. Yep. Oh, you all do a fabulous job. Promotion of social prescribing services, understanding of social prescribing services, yeah. Advertise, yeah, so promoting. I think the challenge with advertising is they're already inundated with referrals, aren't they?
Yeah, I suppose, Claire, that's something that I didn't quite say, but it's worth noting that a lot of the services are inundated with referrals and they're very, very popular. And as a result, there are some areas that do hold waiting lists. So if anyone is wanting to be referred to social prescribing, do speak to your GP practice as a first port of call and inquire about whether there's a waiting list when you speak to the team. I can't speak for every area, but I know a lot of them do have lists. If we promoted it anymore, I think it'd be would be even more inundated, to say the least.
I'm interested in the comment about equality across social prescribing roles. Does that mean consistency, or does it mean an equal number, or treated equally, or all of the above? Pets and pals involved. Okay, yeah, I think patients can make referrals, but can make complaints via pals, can't they, about social prescribing?
Definitely more social prescribers, that'd be good.
Yes, but I think we need the VCSE funding for VCSEs to go alongside that.
Mm-hmm.
Without that, it kind of defeats the object, doesn't it?
Yeah.
If you had more voluntary sector activity, maybe social prescribers would be able to move patients on more quickly.
Mm-hmm.
I still see that some people are typing. Some people are arriving.
Yeah.
We've got one final question after this. It's more of an evaluation question. But I will just wait for final typing to finish. More people are typing now. Voluntary sector essential, yeah. Collaboration, yeah. Okay, so I can't see anybody typing now, so I'll move on to the final question, which is there anything you can suggest to improve this presentation?
Be honest.
All results remain anonymous, by the way.
Completely
so
anonymous.
Don't worry.
Oh, that's a great idea. Patient voice.
More case studies.
More
yeah.
case studies.
Yeah, okay.
Mm.
Yeah. There's that video of East that went on East Midlands Today, which was a really great case study.
Mm-hmm.
But an actual patient here today would have been good, wouldn't it?
Yeah. Great suggestions.
Yeah. Enjoy the interactive aspect. I must say, this is the first time I've used Slido. I'm very impressed with it. Like, I've been a participant, but it was just so slick to set up.
Mm.
Yeah. Ask people what they want. Share it more widely. It's available, isn't it, Lee, on the website?
Yeah, it is. It will be getting, today's session will be getting uploaded this evening, and shared on the website. And that'll go out to with a link to the next session, which is on diabetes, but I'll mention that just after we come on to finished up on this slide.
Could the video be shared across PCNs to promote social prescribing service?
Which video? Do you think the first one we showed, or the one of the Derbyan?
Or this session?
Oh, this video.
I probably
Hi,
will
Jess.
share it with my
This
contact.
session.
Yeah, when it's uploaded and finished, I will share it. And I have already shared the video at Derby on.
I'm just going to repost in the chat the link to the Derbyshire Dialogue webpage, because that's where we house all the initiatives, all the sessions we've recorded. Essentially, it links through to a YouTube recording, so you will get a direct link to the session there as well. But we'll be downloading this session and uploading it to where you can find it on that link today.
Okay, we could pass it out to our contacts then, couldn't we?
Yeah. Well, I think all the Mark may be able to correct me here, but all the participants that register for today's session will get kind of a post-session email, and it'll have the details in there. And yeah, please do everyone share it far and wide. That's in large part why we record the session, so we can get more reach. We appreciate not everyone can attend on the time, but the 37 that did attend.
There were 38, I think there were 39 at one point, Lee. 39 it was 39.
So
39, Lee, yeah, I wrote it down.
So everybody was wrong.
We're having a little bet on that at the start of the session. It's a really good conversion rate, that, for the 50 odd people that registered. Yeah. So
okay, so I see that no further people are typing, so I think that concludes our session today.
Yeah,
So
brilliant.
I'll stop sharing my screen.
So can I just first of all thank everyone for attending and engaging with the session, as we saw some of their the evaluation of the session there. I think it did go down really well, having an interactive session, and that depends on everyone involved in this session. But also, obviously, a special thanks to Claire and Faye for coming along, putting together a really informative presentation, really engaging. Also, to Fraser and Jacinta, the BSL interpreters, thank you very much. As I say, this session has been recorded. We'll be uploading it to the link I put in the chat box just before. And you'll also see on there information about how to sign up for the next Derbyshire Dialogue session, which is on diabetes and will be held on the 10th of April. So thank you all for attending today, and have a great afternoon.
Bye, everyone.
Thank you.
See you later.
Great